All right, we are here with James Cotter, and I'm going to ask him a few questions about his PRP treatment this morning and how that went. So, James, how are you feeling?
To be honest, I feel fine. It's I thought there was going to be a lot more swelling and I was going to be limping around, but obviously I'm not going to go running today. But I feel good.
So you got PRP treatment this morning. That's what you're talking about. What does that stand for?
It's platelet-rich plasma. So I just pretty much went in this morning and they drew 60 mils of blood from my arm, and then they stick it into a centrifuge and spin it at 3,200 RPM, and then that pretty much that's the science of it. It spins the blood so you can get just get that platelet-rich plasma, which helps with all the healing and heals the injury. So that's kind of what PRP is.
And that's what you went in for, to heal this?
That's what I went in for, yeah. I've kind of been, well, anyone who is on my blog or knows me knows I've been dealing with a little nagging knee injury that happened early 2011, and it's kind of held me back from accomplishing the results that I feel I'm capable of, and been doing massage, strength training, acupuncture, chiropractor work, and it's all been working very well, and the pain went down tremendously. And then since we're going to New Zealand, I just wanted to do one last thing to hopefully kick this for good so I can start training and be at 100% for 2012.
Very good. So what can we expect in the next few weeks? How is it going to play into your training? Or
the guys at ProloAustin, Dr. Fullerton, who did it, said to just pretty much the next 2 weeks do very, very light training, maybe easy 1-2K swim in the pool, all small chainring stuff on the bike, and aqua jogging for running and not running on the pavement. And then after 2 weeks we can slowly start building into training, and then start building up for Ironman New Zealand, which is the plan. And
your diet, do you have to make sure it's nice and clean?
Oh yeah, nice clean diet. The big thing is you want to avoid all anti-inflammatories, compression, and the use of cold packs, because what you want to do is you want to let all the swelling, you don't want to reduce the swelling because that's what's helping the injury. So you want to avoid all that, and then clean diet. You advise to take a multivitamin, glucosamine, vitamin C, zinc, and some fish oil just to help aid in the recovery.
And is your wife in charge of your diet? She do a good job?
She does a great job.
So yes. You should be at 100% in no time.
Yes, that's the plan anyways. But it was definitely, I mean, obviously I don't know how things are going, but at the moment, just because this is just a few hours fresh, but I was really happy with it. It wasn't as painful as I thought it was. We've got some good video footage, which will follow this clip of the whole process from start to finish, so you can see what PRP is all about. And then over the coming months leading up to New Zealand, I'll just be doing updates about the treatment.
Sounds good. All right, we'll look forward to it. Bye.
The 60 ml syringe into this neat little tube here, and we're going to stick it in the centrifuge and spin it, and then after 15 minutes it separates out, and we'll show you what it looks like separated out.
So it's a blood cell, the red blood cells are spun out and you're just left with the platelets?
Mm-hmm.
Okay, nice.
Just close it, turn it on, and it goes 3,200 RPMs for 15 minutes. Push start. Out of the centrifuge, it's separated out, and this is the platelet poor plasma, which we're going to draw off with this syringe here. And then down here, this layer here is a layer of platelets, and we're going to take that and use that in the knee.
Nice. Awesome. Cool. And here's the man himself, Dr. Fullerton.
Oh my goodness.
Yeah. First shot.
Yeehaw. So this was that thick plasma at the bottom, not that clear solution at the top? Or?
Right. Well, it was
Okay.
in the middle layer.
Okay.
So it has some red cells, a little bit of white cells,
Okay.
but a little bit of plasma, but a high concentration of platelets.
Okay.
Ouch. And a little bit bigger needle, right? So, and then check the screen there. See the needle. And push a little platelets in. Basically, that little fascial plane there is what it looks like. It was still weak from that old wreck.
Mm-hmm.
And we're going to get a little farther down there.
Just reach past it. Sorry.
Little hip cleanse. And a little ouch. You just want to prove you weren't crying during this, right? Okay. So, and switch that for a new needle.
So what's the difference between Prolo and PRP?
Well, people who've done Prolo for decades would say PRP is another form of prolotherapy. Prolotherapy, the original term was, Prolo is short for proliferation, so it's injection that proliferate normal tissue. So you're basically injecting to stimulate repair.
Mm-hmm.
And it may not matter as much what you inject in some cases. You know, it may be that if you just needle the tissue and inject just normal saline, you'll get some response from the body to get it to repair. As long as you don't interfere with that process by taking anti-inflammatory medicines, injecting steroids, which tend to limit your repair response.
How long do the platelets stay in there for healing the area?
Well, they should activate fairly quickly. So we have you sit here for 10 or 15 minutes because we want them to activate, release their growth factors. When they're exposed to collagen fibers, they tend to activate. So when you're injecting into the soft tissue, they activate pretty readily. Or if you have a little fluid in your joint, they'll tend to activate because of the synovial fluid. So, and then it's like tipping the first domino in a repair response. So you get the growth factor release, and then that'll start attracting various cells, including some stem cells that tend to activate some stem cells that are in the joint. For instance, there are stem cells in your ACL. So there's that healing potential there. It's how do you activate it? How do you get that first domino? You got a little dry one there.
Yes.
I gotta pound up some gel.
So you use 2 mLs in the quad.
Yep, so that's good. So we've got about 4. Okay, so you can gently push your knee down into the pillow there. And then relax it, actually.
And what are you looking for in the knee right now?
I'm looking for that fluid that we were seeing earlier, because we want to make sure and get the PRP into the synovial fluid so it'll spread all through the knee joint. And try to relax your quads a little bit. There we go. So a while ago it was bubbling up right there. There's a little. Get you rolled a little this way. Be better if we could do it with your leg relaxed so you don't have to stay tense. Might go down on the megahertz there a couple flow levels. Have Beth push on this a little bit.
Do you want me to do that now?
Trying to keep that numb spot here.
Right here.
Now we're going into the fluid with this shot.
Right. Tell me if you don't feel numbness, or if you feel any of the stick. Try pushing a little gently on that kneecap towards me. Okay, push the pause button over there. Push the pause, there you go. Alright, so then we can play that back and save it. So there's the little needle tip. And you can see that PRP flowing into the fluid there, a little white. That's going right under the kneecap. This is the kneecap,
Okay.
which is where the cartilage was worn.
Okay.
So it's going right underneath. Cool. And you got a little dry one there. Move it up and down a little bit. That'll get it to flow all through the joint.
Well, those were all. That's all the shots.
Yeah.
Oh wow, that's
Not too
quick.
bad, right?
No. So how long before athletes can start training after the shots?
People have various protocols, and it depends on what you're treating. So right now you've been fairly active, not for you active, but compared to a normal, typical person.
Yeah.
So usually we'd say wait at least 2 weeks, and then a gradual reintroduction of activity after that. If you were working on like a significant tear, then you'd probably wait more like 6 or even 8 weeks.
Okay.
But yours is more dynamic, small tears in the quad and in the cartilage wear and tear, and then a little bit of loosening in the ACL. So by getting the fluid into the joint, it will spread to the ACL, the cartilage, and then the quad we hit directly. So, so it's not like you have a complete compromise of a tissue, you know, where you've got this big tear. You've got basically everything intact. It's just more wear and tear on it. So you don't have to wait as long.
Yeah. And you've had a few athletes from Austin come in here, and what's their success rate with the Prolo and PRP?
You know, well, I hate to do percentages because I try to be scientific, so I would love to have firm data. You know? But in general, it's 70 to 80% would be a guess.
Yeah.
And of course, what I tend to see are the ones who failed everything else. So and sometimes you got to be persistent to find the location. For instance, we had a guy yesterday who we did 2 prolos on his shoulder. He had shoulder pain after doing some weightlifting, and it persisted for months, and he had seen several physicians and not getting any better. We did 2 prolos and he had no change. So to me that says we're not getting to the right spot.
Yeah.
So I had to rethink where his injury exactly was and do a little more ultrasound, and I found that his insertion of the latissimus dorsi, which is kind of hard to see, was looked compromised, and he tested very weak with it. So we treated there once, and when he came back he was like, it's like 50-60% better.
Nice.
So it really matters where you treat, which is why I spent a lot of time doing ultrasound and trying to figure out the best place.
Yeah. I tell you what, I'd rather have a few sessions than go in and get a surgery.
Right, exactly. So it's worth preserving tissue is key. Anytime you do surgery, you have to sacrifice some tissue. I mean, you have to cut through tissue to get in, and then usually if it's arthroscope, they're debriding, meaning they're having to tear kind of loose pieces out, which is sometimes what you need if you have a loose body or something in the joint. Then it's better to take that out, but overall it's better to preserve tissue as much as possible.
And then how long does it start to, you start feeling a difference? So I've maybe had a numbness of like a 2 out of 3 pain. When would you start feeling the effects?
Well, it's like any recovery from an injury. So it's like, at what point after you sprain your ankle does it feel better? Well, it's kind of very gradual, and 4 to 6 weeks. And so you kind of don't, and so people who come in, for instance, who have some memory problems, older folks, and we'll do a treatment and they'll come back and they go, well, it didn't work, and their family will be going, oh, she's walking much better. And it's like they don't realize that it's such a gradual change. They just think, well, it's kind of the way, we can't attribute it to the treatment necessarily. But when you see people who've had, for instance, 10 years of a chronic problem, the same recurring injury, and then over a couple of months getting treatments, they realize, hey, I'm not even thinking about that anymore. I've been thinking about it for years. That was my case with my knee. I went for 9 years and couldn't ride a bike around the block, and I had 4 treatments on my knee, and I was like, well, I'm not sure it's done anything. And then I went and hiked the Grand Canyon with my brothers, and I realized when the trip was done that I hadn't thought about my knee, and I was like, something changed. Something did change during that time. But it was so gradual, and I hadn't stressed it in so long, I didn't realize it had changed.
Well, that's huge. So I've been thinking about my knee for the past 1.5 years, and
so that's when you found the cure, is when you don't think about it anymore. So I'm always ready to hear, it's still not there yet, and then I problem solve and try to figure out the next step. But I don't give up very easy. Because there's a solution. You just have to keep searching. That's my philosophy, because that's what happened to me. It took me a long time to figure out a solution. But
And for your knee, did you have Prolo or PRP?
Prolo, just dextrose.
Okay. All right. Well, there's a PRP for you, and follow us on our journey. We're heading to New Zealand and trying to do Ironman New Zealand, but we'll keep documenting.
When is Ironman New Zealand?
March 3rd.
Wow. Okay. You're gonna have to email us to let us know what's going on.
Well, we'll be blogging all the time, so it's going to be a big blogging trip. So there you have it, PRP. And if you're in Austin, Texas, come check out ProloAustin with Dr. Fullerton.